Good afternoon, everybody. I am DeAndre from the University of Maryland Capital Region Health, and welcome to our Facebook Live. Joining us today are three experts from the Physical Medicine and Rehabilitation Department: Dr. Courtney Fields, who is a physical therapist; Tiffiney Dorsey, who's a speech-language pathologist; and Wright Scott, who's a occupational therapist. Our special guest patient is Ebony Brown, who received inpatient and outpatient care here less than a year ago following a car accident. Ebony, thanks for joining us. And to you all, thank you for joining us as well. Ebony will share her story with us in a few minutes, so be sure to stay tuned in. If you have questions for any of our guests during this live session, please leave them in the comment section below. Also, let us know you're watching by liking our Facebook page, liking this session, and sharing it with your friends. To start today, whether from a head injury or a spinal cord injury resulting in immobilization, the goal of rehabilitation for traumatic injuries is to help patients progress as they gain strength and confidence to perform basic daily living skills and pursue active, independent lifestyles. So, Dr. Fields, what are some of the reasons people may experience a spinal cord infarction?
They can happen a variety of ways. In this setting particularly, they most happen traumatic because we are a trauma hospital. In Ebony's case specifically, she actually had an aneurysm that ruptured, so it caused decreased blood supply to her spinal cord. So that is what caused her main injuries here.
And what are the effects of Mrs. Brown type of spinal cord injury and on her mobility?
With her mobility, because of depending on the level, so how high up the injury occurred, can affect her overall mobility, so paralysis in her legs, sometimes her arms, her ability to control her trunk, her respiratory status at sometimes can be compromised. It all depends on how high the actual level of the injury occurred.
Okay, thank you. So, Ebony, tell us a little bit about your story, kind of like what brought you here to Capital Region Health, and what was your experience like while here for both inpatient and outpatient care?
I was in a car accident October the 26th of 2016. Me and my daughter, I came here with a crushed aorta, broken femur bone. I had face reconstruction. Well, when I was here, I don't remember. I was in a coma for 33 days. And when I woke up, I couldn't talk. I had the trait. Everything looked like a blur to me. It was really scary when I first woke up, just understanding. They did lots of tests, MRIs. That was really scary for me, very scary. It was just so many different doctors. I didn't quite understand a spinal cord injury. I'd never been in no type of injury, and the doctors kept saying they didn't know at that moment. Then I realized one of the doctors told me it had been a one-time event to the spine, so it's considered a spinal cord stroke. Here I started to see, different doctors for my aorta and my femur. They ran many of tests. It was physical therapy. It was great, really great. Different people. I couldn't do nothing then. I couldn't move. I couldn't feel nothing from the waist down. I couldn't move my hands much. My hands came back pretty fast, but after that it was just my legs. There was no feeling, no movement, nothing. Couldn't do nothing from the waist down.
Wow. Thank you for sharing your story with us. So I understand that after the accident, you were told that it's possible that you would probably or potentially never walk again.
Yes.
However, today, as we see, you're mobile and you've transitioned back to your daily life, or you're transitioning back to what it once was.
Yes.
So can you describe how you felt when you were told that basically you would never walk again?
The first feeling is you can't even process something like that, when you used to doing daily things. I'm a mom of 2 daughters, and just to say you're never going to walk again, I was just crushed. And my mom would say, you cannot, she said, dispute all of that, you know what I mean? Just put God first, and that's what I did. She said, focus on what you're trying to do, where you're going to, and that was always my goal. I just never settled that I wasn't going to walk again.
Understandable. So describe for us and our viewers, what was your time like after you received the news to current?
When I first received the news, I would just cry. You know what I mean? I would read. I would go on YouTube, read videos, and just get knowledge, and talking to different doctors. I got a clear understanding, okay? And I'll ask this doctor, or I'll ask people, and I'll say, well, when I went to rehab, University of Maryland, Baltimore, Cameron, and I would go there, everyone had a spinal cord TL6, and I didn't understand what was mine because no one never told me. And so it was the one-time event, and everyone's different. And I learned just time. Time is nothing. I think even with therapy, going to the gym, nothing really helped, but just time healed my body.
Mm-hmm. And so you're currently receiving therapy right now, and where are you receiving therapy at?
University of Maryland, Charles Regional in La Plata.
And how's that going for you?
I've been working with her since I got out of here from Baltimore. So I've been with her for over a year, and it's a slow progress, but it's very good. She's very consistent, and I love it.
Good. Well, thank you for that information. It's definitely been helpful for our viewers today. So, Dr. Fields, Ebony, and Joy, I want to kind of switch gears to talk about the different aspects of the physical therapy that can happen. So, how can PTOT and speech-language pathology assist a patient in regaining functions after an accident such as Ebony's?
So for physical therapy specifically, because Ebony's was such a one-time incident, like she said, we focus on her main issue. So her main issue was not being able to get out of bed. So in this setting, in the acute setting, we try to regain function, independence as much as we can in this level. So we're working on her getting to the side of the bed, being able to sit up on her own, being able to sit in a chair, stuff that she normally was able to do but couldn't do. So we work on just the basic simplicities. Make sure you can see if she can move her legs, work on her trunk control, stuff like that.
Tiffany?
And as far as my role with working with Ebony, when I first encountered her, as she said, she did have a trach, which is a breathing tube, which is inserted in the neck. Typically, that's something that is placed if a patient is still having respiratory issues, and that's a more comfortable means and also allows to facilitate communication. As a lot of our patients that come in as traumas typically have a breathing tube that is placed in their mouth and down their throat. So therefore, you could see why that would be a complicated thing to have and why that wouldn't facilitate a patient's functional progress. So when my first day working with her, I actually worked on using what's called a speaking valve, which is simply a small button that goes on top of the breathing tube, and this allows the patient to be able to talk and to communicate. And for a lot of our patients, communicating is one of the biggest things that is so important, because then that gives them the opportunity now to be more of a participant in their care, to be able to express their wants and their needs, and to be able to make simple requests that we typically, anyone who has never experienced this, would take for granted. The second aspect of me working with her involves swallowing. So upon doing the speaking valve evaluation, then I introduced different liquid and food consistencies for her to swallow, and we were actually able to start her on a liquid diet the first day that I saw her. And then as I followed up with her additional days, we progressed that diet to a solid consistency, and ultimately by the last time that I actually saw her, she was breathing and doing well enough with the speaking valve that she no longer needed the trach. It was removed, and she was actually tolerating a regular diet. So she made tremendous progress working with me.
Yes, I think I remember you, Ebony, when you said that you were very excited to see Tiffany when she
Yes.
came in because you felt like she gave you your voice back, and it was
Yeah,
a
you
really
look
good
forward to
experience.
seeing her. You know, I couldn't eat nothing. You can't talk. I couldn't write because my nerves was really bad
Mhm.
then. So, you really look forward to seeing her from the liquid diet, even to eat. And when I was here, it was around Thanksgiving, so I was here, looking forward to see her.
Joy.
As an occupational therapist, we often look at patients' needs as well as their wants in order to perform therapeutic activities such as daily living skills, which is a part of the word occupation.
Mhm.
Miss Ebony, because of the lower body paralysis, it was difficult for her to do lower body activities like bathing and dressing and those sort of things. So I provided her with a sponge, a reacher.
Mhm.
I might have provided her with a leg lifter.
You did.
And as well as a sock aid, in which for her to feel as though she hasn't lost control
Mhm.
of her body, of her abilities to do. We understood the traumatic part of this whole incident, so we need to look at her in a more holistic manner.
Mhm.
So we have to look at not only what is her physical disability, but psychologically, how is she doing? What's going on with her? So by giving her daily activities to do, it put more control in her hands versus having family, nurses, what have
Mhm.
you, do these type of activities for her. She was very motivated. She was really an excellent patient. She, tried to do everything that she could. So we're very proud of her.
Thank you.
Great. I'm proud of you too.
Thank you.
Ladies, thank you for that insight. Before we continue, let's give a couple quick introductions. So operating our camera today, we have Mike Ruddock, and assistant with questions is Annette Brown, both from the marketing and communications team. So Annette, are there any questions from our audience?
Yes, one question. What are some of the challenges caregivers face when they are caring for a loved one with a spinal injury? And what are some of the resources that they can use to get help?
So any of you can feel free to chime in and answer that.
From my experience with the few spinal cord patients I've worked with, caregivers most often have the time with the psychological aspect that the patient is going through. So although you can empathize, you truly aren't in the situation. So sometimes the patient might become depressed, or they just want help and they can't get it, or the family doesn't know what to do. So it's really important for the family and the patient to ask questions. That's part of our profession, is to educate. So ask questions, see what they can do. There are a lot of resources, like Ebony is saying. You can simply look up YouTube videos. There's a lot of stuff on the internet.
Mm-hmm.
We also have a lot of stuff as our resources, reading material that they can have on the various diagnoses that kind of help everybody understand. I think that's one of the biggest issues, is not being able to understand what the injuries are and the journey that's to come. That kind of makes everything a little bit better.
They also have support groups
Mm-hmm.
in the community as well that can also help the families as well. Also, as a team, we give out a lot of handouts
Mm-hmm.
because there's so much going on at one time, until sometimes it's difficult for the patient as well as the caregivers to absorb it all. So we like to give them out handouts so that they have, and highlight, so that they can have something that they can refer to and share with others, so that it helps them through this process as well.
For me, I think what got me through was my family. Luckily, I had family when I went home. Then I couldn't move. I couldn't do anything on my own for at least the first 3 months. I mean, catheterizing and bowel training, I couldn't do anything, let alone, I couldn't even go to my house because I live up steps. So I had to wait and get another apartment on a bottom floor level to even get home. So I couldn't do nothing without my family.
Annette, any other questions?
Yes, one more. Do all patients with spinal injuries receive the same type of physical therapy?
Absolutely not. The spinal cord is very long. As we all know, it runs from the bottom of your skull all the way down to your tailbone. So depending on the level of injury, depends on how involved the patient can be. The higher up, the more involved, the lower down, the less involved. Everybody's different. In Ebony's case, she was a spinal cord, but she also had various orthopedic injuries. So her case was a little bit more specific and tailored just to her. But no matter what, no one patient is the same. Everybody is completely different in their journey.
Would you ladies like to add anything else to that?
Well, that's one reason why when we assess a patient, it's all individualized because of that factor.
Mm-hmm.
So, Dr. Fields is correct. We have to customize every situation so that it can best so that it can best have the needs of the patient first.
Okay, understandable. So as we wrap things up for today, I have one more question for you ladies. What is one piece of advice you would offer a person after they experience a spinal cord injury?
My advice would be never give up. It's a journey, but as Ebony has proven, it's not one that is permanent. There's still a possibility of you regaining your independence and having the life you had once before. So have faith, work hard, and you'll be back to what you want to be.
For me, I just put God first. With anything I've done, I just put God first. And I just never settled. I just kept thinking of where I was going to. So I just knew I was going to walk. So I just put God first. And I just never, even when I finished therapy, I had stopped therapy, I got a trainer, went to the gym, and I just continue. And that's pretty much it.
I think that I would just encourage all the patients to stay strong, to have faith, to look to, like Ebony said, she went online, she asked questions, and to even take heart from her story, to use that as an inspiration, and to also know that during those trying times, especially when you're in the acute phase and you start working with therapy, to look to your therapist as a partner in the journey who's looking to try to motivate you toward what you can accomplish and what your future holds, and that we're in the journey with you, trying to maximize your level of independence, because just as much as you want it, we also want that for you as the patient.
Since everybody took mine, just never give up. Always have a sense of hope. Ask a lot of questions. There's no such thing as a dumb question. Just ask a lot of questions so that we can help you, and also one day at a time. One day at a time. Sometimes there is a setback, but that doesn't mean that's going to hold you back. It's just stuff happens. But keep plodding on, keep moving forward, and you'll have good outcomes most of the time. You'll have very positive outcomes most of the time. But never ever give up hope, or allow anyone else to take that hope from you.
That's right.
Dr. Fields, Ebony, Joy, and Tiffany, thank you so much for your time. For those who want even more information than what was provided today, please visit the Physical Medicine and Rehabilitation page on the Capital Region website found under Health Services tab. Our website is located at www.umcapitalregion.org. We have been speaking with experts today from the University of Maryland Capital Region Health Physical Medicine and Rehabilitation Department. Thank you to everyone who watched, and have a great day.